Jefferson also said the normal course of things is for liberty to yield and government to gain. And that's what you have seen with the monstrosity called the health care reform in the last year, proposed by the President, by Speaker Pelosi, and Leader Reid. It is outrageous what is in that bill, in both the Senate and the House end. It is liberty taken away. And I'm sick and tired of hearing people, including some in the media, say that Republicans are the party of no. They're against reform. We are not. Healthcare needs to be reformed, but it doesn't need to be taken over by the government. We need insurance companies out from between patients and their doctors, but we don't need government substituted in between patients and their doctors. For those on Medicare and Medicaid, they need to be assured that it will be there and that they will have coverage like they've never had before, but it can be done without $500 billion in cuts and the rationing of the health care that's coming. The President made some wonderful promises before he got elected. Transparency was one of them. If you had had a chance to see this thing negotiated, you would have seen the insurance company say, oh yeah, okay, we'll agree to sign on if you'll give us a provision that says we can't be sued successfully for denial of coverage. That's in there. And for the plaintiff's lawyers, okay, you'll get to sue under state law for those that are under the federal insurance program. Let's see, okay, and by the way, for the states like Texas and California that put caps on damages or attorney's fees, we'll stick back over here around page 1500 where people won't notice it, a provision that says the Secretary of Health and Human Services can pay a bribe, well, for such amounts as she finds appropriate, to get them to eliminate their caps on damages and attorney's fees. There's pharmaceuticals that signed on. There's something in there for them. You should have been able to see that negotiated, and that's why here the first provision that it says is protect as in violate the vital doctor-patient relationship. Number two, and let me get this over here, reject any addition to the crushing national debt heaped upon all Americans. 3, improve rather than diminish the quality of care that Americans enjoy. 4, be negotiated publicly, transparently with genuine accountability and oversight, and be free from political favoritism. 5, treat private citizens at least as well as political officials. 6, protect taxpayers from funding of abortion and abortion coverage. 7, reject all new mandates on patients, employees, employers, individuals, or states. 8, prohibit expansion of taxpayer-funded health care to those unlawfully present in the United States. 9, guarantee equal protection under the law and the Constitution. 10, empower rather than limit an open and accessible marketplace of health care choice and opportunity. As a member of Congress, I've heard people say, well, we want the health care you had. Well, you didn't want what I had last year. I didn't like it. I changed it. You didn't want my health care. You want my choices. You want the booklet I had that says you can choose from the marketplace. We want this discussed openly and honestly, and we look forward to candidates, members of Congress across the country signing the declaration of what they're willing to stand for so we get the health reform people deserve in this country. Thank you.